we're talking to Dr. Macias. He is a pediatrician here in San Luis Obispo County, and he's going to share with us a little bit about the role that nutrition plays in pediatrics. Can you tell me a little bit about some of the most common nutrition-related ailments that you see in your patients here?
Typically, just like with the rest of the nation, what we're seeing, we have a lot of issues with obesity. That would probably be the biggest problem that we see. There are a few, scattered cases of eating disorders.
Really?
Anorexia, occasionally bulimia, but for the most part, the majority of cases that we deal with on almost a daily basis is overweight children. For a lot of families, one of the main problems is in regards to infants, they often want to feed them too early, and they're anxious to get them started on food. And we're concerned nowadays, especially, that might be just the very beginning risk factor for developing overweight children. So every day we're talking nutrition.
So that was going to be one of my next questions, is if you gave the nutrition advice yourself, or if you ever kind of outsourced to registered dietitians for that.
Well, for the basic recommendations, we don't outsource. We're providing that. We're kind of in the trenches, primary care. So we're providing that information. And of course, when we're dealing with other issues, for instance, a child that's we're concerned about their body mass index, that they're obese, usually we try to get them in to see the dietitian. Very interesting, though, that a lot of times insurance companies will not cover the visit or only allow one visit. And as you may be aware, the problem of obesity requires more than just a shot. It's not just a Band-Aid over the wound. It requires major changes. And so we'd like to use dietitians more often, but oftentimes we're kind of tied, our hands are tied because of the fact that insurance doesn't cover it, or they only cover one visit, or if a family doesn't have insurance, they can't afford to take their child for the consultation.
How do you manage your patients who come in who are overweight?
Well, typically when they come in, often for their well-child appointments, we're measuring height, weight, looking at their body mass index. We actually have on our electronic records graphs that we can show the family. So when we have children that have a BMI that's above the 85th percentile, as they're approaching that even, we're counseling. When we have a child who's there, then we talk a little bit about their weight issue, try to address that in a way that's non-confrontational. In the news, you hear about all these diets. Watermelon, fad diets, watermelon diet, whatever, juice diet. And I try to tell them, we have to look at the foods that you eat that are natural in your home. If it's a Hispanic family and you try to give them a diet that involves foods that they don't normally eat, you're already doomed to failure in a way.
Makes a lot of sense.
So getting them to the nutritionist, and I try to tell them, when you show her what you eat, and she can work with you and give you choices of what you already have in your diet that you may just need to adjust and have success. That's usually a time when I want to try to refer out to the nutritionist. Oftentimes, this is another time when then we'll send them for laboratory tests, and we'll take advantage of the fact that we're sending them for labs. So, we're doing a chemistry panel, looking for anemia, checking their thyroid, hemoglobin A1C to look for diabetes. Depending on their physical exam, if there's some concerns that they may have some stigmata for type 2 diabetes, like acanthosis nigrans, a dark line hyperpigmentation along the folds of the skin, maybe check their insulin level as well. And more often than not, when you're looking at a child that's overweight, the people that are sitting in the room, which are usually the parents, at least one of them is also overweight. So try to stress and explain that this is a family problem. This is not just the child's problem. This is a family problem. It's going to require a team effort.
Do you see a lot of children coming in with type 2 diabetes?
Well, it's interesting that you asked that. We know that type 2 diabetes is on the rise, but oftentimes, and we have patients that come in and we're very suspicious that that may be the case, but when we look at what the diagnostic criteria are that they need to meet to fit that diagnosis, many times when we test, they don't meet the criteria, although we feel very strongly that they're on that path. So then it just prompts us to want to kind of keep a closer eye on them. So that's something I think that's changing, because it's very apparent that the number of cases of type 2 diabetes are increasing, and especially amongst teenagers and minorities.
Is there anything that you want to let the audience know, just a take-home message? They take one thing or a couple things from this, what you want that to be?
You don't have an hour, so, but to try to put it in a nutshell, of course, number one, breastfeeding is very important.
Yeah.
The next thing would be to start your infants on solids when the pediatrician recommends that. And then basically not only eat healthy, the whole family has to eat healthy, but exercise becomes important.